Welcome to the Renal Research Institute's Frontiers in Kidney Medicine and Biology, where we share knowledge and advances in kidney research with the world. In this episode, I'm joined by Dr. Len Usvyat, Senior Vice President and new head of the Renal Research Institute. Together, we will discuss the transition of leadership as I hand over the reins to Len and explore what lies ahead for RI under his guidance. Welcome, Len, to this episode of Frontiers.
Well, Peter, thank you very much.
Len, it's really a pleasure having you here. And thinking back, I believe we met for the first time in 2003 when I spent, I guess it was something like 6 weeks at the Renal Research Institute. We ran into each other and you were, working on some data analytics. And I think it immediately clicked in a way, didn't it? When we start discussing about the data you have and the kind of analysis you're doing.
Yeah, no, absolutely, Peter. I think it was when we first met, I actually vividly recall that some of the RI-related analytics were done using very manual methods, using mostly Excel spreadsheets. And so I do actually very much recall our conversations about the power of bigger data before the term big data was actually even invented. So I recall those days very well.
I went back from the Renal Research Institute to Austria, and in 2005, I joined RI again back then under the leadership of Dr. Nathan Levine, my predecessor, and I stayed there for a year. And during this year, actually, I think the data analytics, at least in my recollection, became such a central part of the work. And I remember that we would develop together some new indicators of inflammation and look into anemia management. It was just wonderful, and you were always really so supportive and helped to advance the field and follow me even into some weird thoughts that led us to interesting statistical analyses.
Yeah, no, of course. Peter, I think you know this, of course, but I actually, when I was younger, I actually wanted to go into medical school. And, I ended up not going to medical school, but it was really our work together back then that made me realize that by using data, you can actually influence patient care. And no, you don't influence it by being there sitting with the patient, but you can very much influence how we deliver care, or you can very much understand various learnings that the data is telling us. So I think it was such an exciting moment. I mean, I very much remember this excitement of being able to see so many different things in our data and not necessarily being a physician by doing so. That's exciting.
Yeah, and you're so right. I mean, this is one of the beauties of medicine, actually, that I mean, whether you sit, behind an electron microscope or perform epidemiology perform statistical analysis, sit in a lab and perform multiomics, or really at the bedside or do surgery. It's such a wide field, and there are hundreds, thousands of ways to contribute to improve the health of our patients. And I think data analytics, has been important for, I guess, something like 2 decades, maybe 2.5 decades or so, starting with the epidemiological study done in the UK on infectious diseases, but then obviously with the advent of computers and large databases, this has really taken off, and you were at the forefront of this.
Yeah, well, I think it was, sometimes in life it's the confluence of 2 or 3 or 4 things together that leads to something really great. And I, very much remember also using, as you probably remember, some of our longitudinal analyses for hospitalization or other morbid events. And again, it's ability to gather insight from data, from large amounts of data, which of course we're very, very fortunate to have this access to as well. And I do also think what of course has also happened is the advancement in technology. So it's not just that we have a lot of data, but the ability to process data quickly, to be able to use new methods, be it data science or be it, computer science, in addition to, of course, the more traditional statistical methods. All of that came together over these last 20
Yeah,
years.
and no end in sight now with cloud computing, both storage but also the sheer speed of computation has increased. I mean, I remember very well, I think it may have been your very first Kidney International paper, right? On the events before death. And this was really, in my mind, this was one of the really important papers I had the pleasure to co-author, because it also led to the foundation of this Mondo initiative, the Mondo standing for Monitoring Dialysis Outcomes initiative, where both you and I were some of the founding members, right?
That's right. And I very much remember the excitement when we were able to see that, albumin has similar patterns across the globe. Maybe some of them are not necessarily surprising, but it is always wonderful to see that type of information, that you would see an average albumin go down before patients pass away or may go to the hospital. So I do think it's a beautiful thing about data, and the ability to process it.
Well, and maybe it's also a beautiful thing about biology, that as humans we share some biology, right?
That's exactly right.
And it was, this was for me actually the profound insight that something we some signal we detected here in the US in some RI patients, a few thousand of them. We actually saw this then in Europe, in Asia, in Latin America, and so this was really interesting. This told me, yeah, we are just sharing some common biology, and this was this was another really beautiful part of me. But Len, I mean, you take the arena over with this very strong background in data analytics, in experience working with large databases. So what's your vision for RI 2025 and beyond?
Yeah. Well, I mean, obviously, it goes without saying, it's extraordinarily humbling on the one hand. On the other hand, I do think it's a very exciting time where the new RI team is really contains all these different skill sets that are in analytics, advanced analytics, statistics, epidemiology, data science, mathematics, and some of the other elements that, of course, you built, and some of the other elements that I brought from my existing team. So I do think the combination of the data that we collect, the skill sets of how we can actually utilize the data, then the ability to actually pilot some of these algorithms or things that we may be developing in our own dialysis clinics that we have access to. And then, which is a very unique element of Renal Research Institute, the ability to collaborate with external academics and external partners, because I think it's so important that when we generate this knowledge, we don't just necessarily do it in one set of clinics, but you actually do it in different types of environments. And, it could be a university somewhere that we may be collaborating with. So that to me is very exciting. So all these different pieces coming together.
Yeah. I think you mentioned something really important. It's this external collaboration. It's certainly one of my goals, and also of my predecessor, Nathan Levine, was to make sure that there isn't a bubble created, right? There are so many bubbles anyway. So I looked it up once, maybe a year ago or so. Since its inception in 1997, RI has collaborated with researchers from over 500 institutions. So, and this is, this is so so fulfilling and encouraging and inspiring to get the input from colleagues really around the globe, because I think there is always the danger to be too focused on one's own, I wouldn't say small world, because your data world is of course gigantic, but also to be always open to opinions, to experiences of other colleagues that work outside of their own four walls. So it's I think this will be something really important. Len, how do you think that artificial intelligence will will evolve over the years to come? Do you think it will become a lived reality for our patients, for nursing staff, for physicians? What do you think?
Well, I certainly think so, but I think it will take some time. I don't think it's a development that will happen overnight. I view AI as any other types of technological advancements. It's the ability to apply maybe new methods, but I still think medicine is medicine and healthcare delivery is healthcare delivery. So I think over time we're going to see more and more smaller developments that come to our dialysis clinics, be it, fistula aneurysm apps, or be it some sort of stenosis stethoscope. So whatever the application is, it's going to be these more individual use cases, which eventually I do think it will become more and more transparent. It's almost like, when we started using iPhones, I don't know if 10 years ago we would have thought that iPhone would really become such an important part of our lives, because initially it was really more about maybe making phone calls and maybe you're able to browse the web on your iPhone, but it's really over time that it's become such an important part. And I view AI the same thing. It will take quite a bit of time. And also we all know healthcare is a very sensitive topic. So I think when it comes to healthcare and making sure that we have patient safety, making sure that we're doing the right thing by using AI, I think all of this is very critical.
Yeah. Do you see actually that AI will be used by patients, that there will be at some point in time, you and your team may develop apps, or whatever, nutrition apps, or whatever, AV access apps or whatever, that the patient will use, so as a sort of point of care tool? Or do you think it will always be sort of centralized?
No, I certainly think that the patients will be using AI a lot as well. But I think what is really important, and I want to stress the point, is I definitely think I view AI as complementary to the skills of our nurses, of our doctors, of course, and other staff that works in our dialysis clinics or in healthcare in general. Do I think there are some pieces that could be handled by AI or an algorithm? I think so. But I think overall, I think it's still very important that there is a clinician in the workflow in many of these, at least in many of these activities. And, as I love to use the airplane analogy. I think it's maybe a day will come when we're going to get on a plane without a pilot on board, but I think that would take quite a long time. So I do still think, despite the importance that technology plays in flying a plane, I think it's hard to imagine the foreseeable future that there will be complete independence of
going from traveler's trains at airports to traveler's cars to traveler's planes. That's the kind of trajectory as you're envisioning. Yeah. Okay, who knows? Now, in your team, Len, you have also a group that really deals with real world evidence generation. So how will this group interact with, say, the more AI team or in the math team? So how do you see that?
Yeah, so that's actually one of the more exciting things. Of course, one of the exciting things to me in this whole development is the fact that I do think we have very complementary skills. And I think between kind of the more real world evidence, more epidemiology focused folks, as well as combining them together with more AI folks and maybe more computer science skills, and then together with mathematical modeling and more mechanistic approaches to things, I think there's actually quite a bit of benefit that we can see from actually combining these skills. I think oftentimes, or at least that's what I often hear from some of the mathematicians, the mathematicians and the statisticians don't usually get along very well together. Well, I think a lot can be achieved by actually putting mathematicians and statisticians and AI folks together. I think it's actually very exciting to me. So, and I think the real world evidence piece, I also want to stress that as a largest dialysis provider worldwide, probably sitting on one of the largest databases of patients with ESKD, but really, it's not just good. I think it's almost like our obligation to be able to do this evidence generation and to share with the medical community of what we see in our data. And I think COVID was a perfect example. The whole pandemic, we had so much data on
Len, do you think actually that large providers or large healthcare networks should make parts of the data public? I mean, obviously, respecting all the necessary privacy rules.
Sure, sure. As you know, Peter, this is a complicated question and has so many angles to it. I think in principle, it's not a bad idea. Now, in practice, I think the issue becomes, and especially in a place like be it Fresenius Medical Care or other kind of large healthcare providers, I think the issue becomes it's that our local data analysts have gathered so much knowledge about the very tiny little intricacies of every data point. We collect millions and millions of data points. And I think it is very easy for somebody who doesn't understand the data very well to take the data set, derive some conclusions, publish a paper on it. And I'm a little bit worried that I think that's what may end up happening when you make these very large data publicly available. It may be a little bit different when you talk about things like CMS data, where the data is very structured, all the same thing, it's all the same claims, very rigid structures. I think with different healthcare providers, it's tough. So I do think in principle, I think it's a good idea, but I think in practice, I think we need to be very thoughtful about how it's done.
Yeah, obviously in Europe, there are initiatives now underway by the European Union to actually mandate that health data are provided. So it will be very interesting to see how this will pan out eventually. Len, I just realized I'm asking all the questions. I mean, oh my God, I totally I missed that kind of that aspect.
Well, as you can imagine, I could ask you so many different questions, Peter, but maybe, as you of course know, as I mentioned in the very beginning, it is a very humbling opportunity for me to try to step into this role. And one of the reasons it is so humbling is because you're an expert in so many things, and your ability to collaborate with others and to think innovatively and to really have this very positive outlook, I think is really important. In mentoring others, I think all these different pieces are what you've done is incredible. And I think that's really important to me. And so maybe the first question is, how do you usually think about what will the future of healthcare be? How do you focus on topics relating to what will be important in dialysis care in 5 years and 10 years and 20 years? As I mentioned at the very beginning, back in 2003, we talked about big data. Maybe you didn't call it big data, but that's really what we talked about. You talked about mathematical modeling in 2007. You talked about AI when nobody really talked about AI. And so I guess my question is, how do you stay on top of these things? How do you think about what will be important in the future?
So I think that collaboration among disciplines will be more important than ever. And every discipline, medical staff, physicians, nurses, but also, statisticians, AI experts, they have to find common ground, even in the conversation, so that a person working on an AI system understands what the medical colleagues actually want to express and vice versa. So I think a major challenge will be to arrive at a common language that eventually will foster the constructive exchange of ideas. And so this, I think, is one challenge. And I think just rubbing shoulders with experts from other fields will be really important. And I hope that technology will bring people more together now. And all these virtual meetings you and I are on across the globe, I mean, this may help here. I mean, there has been a tendency in medicine over decades, if not centuries, starting, I think, with the year of enlightenment, just to be more and more segregated. There was this holistic healer at the beginning, and then it became more, there are surgeons, and there are then those in dermatology and obstetrician and so on and so forth, and it got more and more sub-disciplines emerged for good reasons, obviously for good reasons, because things just became more and more complicated. What I really hope that maybe through modern technologies such as artificial intelligence and other tools, that to some extent convergence may happen again, so that the connection between people who are specialized in liver disease and those who are specialized in kidney disease, that they find more common ground, because we function as a human being in a unity. This whole separation is in various disciplines. It makes sense from an effectiveness standpoint, and because it's gotten so complicated. But somehow, and I don't have an answer, obviously, I would really hope that again a more holistic view of the human in front of you, be it a healthy person or a patient, will emerge. This, I think, it's a big challenge, and as I said, I hope maybe through some AI developments this could be facilitated. Medicine will become more embedded in technology, I have no doubt. I also think that more responsibility will be given back to the person, the healthy person and the patient. So more point of care or at home therapy, at home diagnostics will come up. Hospitals maybe, they will be there to perform highly specialized interventions, but a lot of the healthcare, I think, will go back to the individual person. It's also mandated by money. It's driven by that, because it's gotten so expensive. Specifically this hospitalized medicine. I hope that prevention of illness will take center stage. When I think about kidney disease, major drivers are diabetes, high blood pressure, maybe even more upstream obesity. So this is something that has to do a lot with lifestyle. So I think and hope that further upstream preventive interventions will, specifically in the field of kidney medicine, help to reduce this relentless growth of patients with end-stage kidney disease. On the other hand, if patients then will have end-stage kidney disease, I really hope that home therapies will become more prevalent, and by doing so give some of the responsibility back to patients. I know it's not for everyone, but I would have thought for a larger proportion than the current one. Well, this is a very fragmented response to what you were asking, but it's a big question. And maybe I should have said I was originally trained as a physiologist to understand, really the function of the human being from head to toe, and then I was trained as an internist, which I deeply enjoyed, because it was also this more holistic approach to a patient. And then, of course, I specialized in nephrology, and now with the past 15 years within nephrology into kidney replacement therapy, and there within hemodialysis. So it's a sliver of the richness of medicine. And I know it's necessary to advance things, but also in terms of care for patients, I think it's important to step back a little bit. So, for example, in my dialysis patients, I would do ultrasound, of course. I would do echocardiography. I would see them frequently, and I would, I would take care of many, many other aspects, illnesses they may have. They may have whatever inflammatory bowel disease. So I would really take care of these things in after consultation also with colleagues. But I think it's important to take care of the human being, its in entirety.
Yeah. Peter,
Balance.
I have to say this is really fascinating. I could probably ask you so many questions on this. Of course, several things came to my mind. One of them was one of your favorite, I think, expressions about the island of knowledge, the expanding island of knowledge. And I think as you were talking about how medicine has gotten deeper and deeper, and our knowledge has gotten deeper and deeper over the centuries, that of course what may have happened, and I haven't thought about it this way, but I think you're absolutely right. What ended up happening is that it is very hard for one person to keep all of this in their mind, all this
Sure.
massive island that we've now created. Yes. So I do think that's actually very interesting. You also brought up something about different opinions. And actually that leads me to my next question, because you have built a very international team. I think you are very diverse in terms of where people come from. And so my assumption is you would also say that in addition to diversity of skill sets and viewpoints, the diversity of cultural origins and where people come from is also very important, I would assume.
Of course. I mean, this has been always my philosophy here. And I have to say in the United States in general, but specifically also New York, that's the perfect, environment. I told you, I believe my last count was that the RI staff member come from 18 different countries and speak 14 different mother tongues. So it's a very, very diverse group, and it's also in terms of skills, it's very diverse. And this is just important, I think, because when we looked at the problem, we looked at our question at hand, we looked at it from different angles, and everyone came up with a different perspective. And then through discussion, through constructive discussion, we came up with some solutions, right? And I think this multidimensionality is just fundamentally important. So you will keep this growing and growing and growing. So this is something that that just makes a lot of sense. I mean, in today's complicated and complex world. I have a very nice example. So, for example, we recently were joined by a pediatric nephrologist from Sudan, from war-torn Sudan. And we learned something from her about diagnosis of peritonitis that she is pursuing, or she applied there. Very low cost. And I was stunned when I learned about this. It just shows there is, of course, knowledge transfer across the globe, not just from the global north, if I may say so, to the global south, but also vice versa. But we just have to be open to and receptive for these thoughts. And I think this is one of the great experiences with diverse teams. And the other is, of course, to acknowledge the limitedness of one's own, knowledge and insights.
It's really quite fascinating. Of course, both you and I are, I guess, fortunate. I think fortunate of kind of having lived in more than one country in our lifetime. So I do think it gives you a very unique, I think, perspective. And I, completely agree, of course, with the diversity of skill sets and cultural backgrounds, because I do think that helps tremendously with how solutions are made. And a lot of companies struggle with some of the globalization, but I actually see it as beneficial if used and applied and done properly. So now that.
And I think as leaders, our role is to create a safe environment where everyone is, free and feels comfortable speaking up, indicating his or her views, and being respected, views being respected. This, I would think, is one of the most important ingredients for a successful organization.
Yeah. It's interesting, the ability to speak up. I think in your group, you have mentored so many people. And every time I show up at RRI and every time I'm there, there's a lot of energy, there's a lot of positivity. And I think, one of the questions I would love to know is how you're able to feed that. You feed in this tremendous environment where people do seem to be very happy and very engaged and very interested in the work that they do. And I think I'd love to know your thoughts about how do you do this in a team, especially a global team, that we're now established.
Yeah, I don't have a recipe here. All I can say is I just profoundly enjoy what I'm doing, and maybe this radiates. I think that's important, that this really radiates. And on the other hand, I'm very curious. I just love to understand what our colleagues are doing, what are they thinking, because there is always an opportunity for oneself to learn and to grow. And because this is a genuine, sentiment, I think that the colleagues feel this, understand this, and I'm always very grateful for any conversation that's held between colleagues and myself, because there's always something to take away, and that enriches you. I think the joy of work, I think that's certainly one aspect, and the other is a very, very high and genuine respect for the colleagues and their opinions.
Peter, as I think we conclude this session, of course, one question I would like to ask you is, what would you say has been the most rewarding experience for you leading this tremendous team over the last 15 plus years?
I would need to think long about this, because I don't rank these experiences. I believe what has been very, very, very rewarding to me is to bring different disciplines together and to enable them to have an intellectually stimulating, a rich conversation across the boundaries, these artificial boundaries of disciplines, and these boundaries also of, countries. And so really bring people together to work towards a shared goal. I think this in general is the most rewarding experience. And again, I think here in this respect, New York is an outstanding place to do that. I can hardly think of any other place in the world where this is possible, at least that easily possible. But yeah, bringing people together and, being able to communicate a shared vision and then work towards a goal together as a strong team. And I think this was the best experience.
Well, thank you, Peter.
Yeah, no, thank you, Len. Hey, man, I wish you all the best. Arise in good hands. And I'm sure in one way or another we'll stay in touch. All the best.
No, of course, Peter. Well, again, thank you very, very much. This is extraordinarily humbling, and for everything you've done, and not just for what you've done, but also over the last few months of this transition period. It's been nothing short of what I would say predictable Peter Kotanko attitude of being very collaborative, very supportive, very insightful, and I'm extraordinarily grateful for this process.
You and the team made it very easy. It's been an honor to lead both RI in this podcast, and I'm excited to see the impact RI will continue to have under your leadership.
Thank you, Peter, not only for your leadership at the Renal Research Institute, but also for the thoughtful conversations you have led here on Frontiers in Kidney Medicine and Biology. Your work has set a very strong foundation, and of course, I'm honored to continue building on it. And thank you to our listeners for joining us for this special episode. We invite you to connect with us on social media channels and stay tuned for future episodes as we continue sharing insights and advancements in kidney research. Until next time, take care, and we'll see you soon.